Dear Dr. Bekim Salih, Minister of Health, dear Mrs. Anne Johansen, representative and head of the WHO office, dear representatives of the diplomatic corps, dear colleagues, distinguished guests. Welcome to the event for presenting the findings from the latest behavioral studies on COVID-19. These studies have been supported by the USAID project for strengthening the capacities for COVID-19 vaccination and the general immunization undertaken by the World Health Organization. During today's event, we will see a presentation of the second qualitative study for COVID-19 vaccination among healthcare workers during the month of February and March 2022, as well as the results from the latest fifth-in-a-row quantitative study on the opinions and attitudes of the population in North Macedonia on COVID-19 undertaken in February 2022. The objective of these studies is to support the national efforts for increasing the COVID-19 vaccination coverage rate and the other measures related to the response to the pandemic based on evidence, and to enable discussion for development of new specific strategies based on the current attitudes and beliefs of the healthcare workers and the population in order to improve the health of all citizens in the Republic of North Macedonia. Apart from the support from the World Health Organization, these studies were enabled with the active participation of many national institutions and professional associations. Therefore, we would like to express our gratitude to the Ministry of Health, to the Institute of Public Health, to the Team Institute for Qualitative and Quantitative Research, to the Ethics Committee at the Medical University in Skopje, as well as to the associations of doctors of family medicine, private primary healthcare doctors, nurses and midwives, and pharmacists and dentists. We would also like to thank the Center for Family Medicine, the COVID-19 centers, the University Dental Clinic and the General Hospitals, as well as all healthcare workers who individually contributed to these studies. Special thanks goes to Professor Elena Kosevska, national counterpart of the World Health Organization for Behavioral Studies, for her support and leadership in undertaking these studies. During today's event, we will have the opportunity to hear the opinion of very important guests, professionals in the healthcare sectors, and together we have the colleagues panelists who will discuss the next steps related to the results of the research. First of all, allow me to invite Dr. Bekim Salih, the Minister of Health of the Republic of North Macedonia. Dear Ms. Anne Johansen, representatives of the WHO, Your Excellencies, dear partners, colleagues and friends. The pandemic of COVID-19 is a global challenge that has put to the test the health systems worldwide, and also our healthcare system was not spared by the severe consequences. The vaccination against COVID-19 has been introduced with many challenges, and from this aspect it has been different from any other new vaccine to date. Convincing people about the danger of the virus and the need for vaccination continues to be a challenge for all of us. The Ministry of Health, together with the healthcare workers, continuously cares for the health of our population. We work on communication and education of the population, as well as of health workers, of the importance of the COVID-19 vaccination. When designing the response measures for COVID-19, the attitudes of the population are becoming ever increasingly important. These studies on the attitudes and beliefs are very important because they will allow us to have a thorough approach based on the actual situation and based on the current perceptions. These will be very significant evidence that will be used for developing future communication and messages in order to reduce the resistance to public health initiatives by the citizens, especially in terms of the COVID-19 vaccination. Of course, we need behavioral studies in other areas as well. Allow me to use this occasion to express my sincere gratitude to the World Health Organization for their continuous support in the response to COVID-19, as well as to the USAID. The COVID-19 epidemic is still not over. We need joint action by all relevant stakeholders, by the United Nations bodies and donors in order to achieve the objectives set out in the national COVID-19 immunization plan. I wish you to stay safe and healthy, you and your families, and let's continue to care for each other. Thank you.
We thank the Minister of Health for opening today's event, and today we will have the speech of Dr. Anne Johansson, a special representative of the World Health Organization.
Thank you very much. Honorable Minister of Health, Dr. Bekim Sali, I appreciate your kind words. Respected professors, members of academia, and healthcare workers, as well as partners from the UN and representatives from the non-governmental sectors. It's my honor and pleasure to welcome you all to this event on behalf of WHO, both here in Macedonia, North Macedonia, and the regional office in Copenhagen. We are going to be discussing the findings of the latest studies about the general population's health care workers' perceptions and attitudes towards COVID-19. And you may ask yourself why this is important. Well, we've all seen during this pandemic people who are well informed, at least in theory, about the effectiveness of our vaccines, refusing them. Obviously, there must be something else that's influencing people's behaviors and decisions. And if you recall the very successful vaccine immunization caravan vaccines recently, it's clear that easy access to vaccines is an important influence. But more than just easy access, behavioral sciences document that behavioral and cultural insights are really important, not only for COVID, but in general. I mean, many of us know that we should live healthy lifestyles, not smoking, not overeating, but yet some of us remain to do so. And so for this reason, the European Program of Work, United Action for Better Health, was adopted by all the WHO regional member states. And an important priority for that is the so-called behavioral cultural insights, which is identified as a flagship priority, so particularly important. And it's to achieve the objectives of this program that in 2020, a new unit was established in the WHO Regional Office for Europe. And part of the work for this unit and for the World Health Emergencies Program is to carry out the types of behavioral culture and cultural insight studies that have been carried out here in North Macedonia, and one of which we will now hear the results from. And these studies are done not only to create suitable messaging, but also to monitor knowledge, practices, and beliefs of citizens related to what we know so far about the virus in order to create acceptable interventions and modify citizens' opinions in accordance with the ongoing course of the battle against COVID-19. WHO is supporting the Ministry of Health in identifying the barriers to vaccinations in different communities, as well as addressing these barriers through complementary, tailor-made activities that will bring vaccines and information closer to citizens, particularly in vulnerable populations. So it's quite clear that social and behavioral data really need to be considered along with biomedical data if we are to mount an effective response. Now, the results of the survey that have been conducted so far has shown that part of the resistance and hesitation to vaccination is due to distrust of the government's advice in certain populations. So we need to find ways to overcome that. We need to find new and creative solutions from all departments in the government and with the involvement of the entire whole of society to achieve results, change behaviors. And it's for this reason that we are having this meeting today, so that we can explore the specific and the latest results, but also to discuss and analyze what we've learned so far, so that we can do better in the future, more appropriate evidence-based activities. Now, before I finish, I just want to thank USAID for its support in conducting this research. We could not have done it without you. In closing, I want to say that I really hope that today's event will identify new ideas, initiative, and activities so that we can achieve better health for everyone while we leave no one behind. Thank you very much, and I wish you a very productive discussion.
Thank you, Dr. Anne Johansson, for your speech and opening this event. Before we continue with our conference, I propose that we see some of the activities of the World Health Organization and the development agencies of the United Nations within this project. We continue with the working part, with the presentations of today's first session about the results from the qualitative survey on COVID-19 and the general population. I would like to invite Ms. Eli Atanasovska-Ognenovska from the Team Institute for Qualitative and Quantitative Research to present the findings from the last fifth quantitative study on the opinions and perceptions of the population in North Macedonia carried out in February 2022. Good day to everyone. My name is Ilana Ognenovska, Executive Officer of the Team Institute, and it is my honor and pleasure to present on today's event the findings from the latest survey. This is part of a larger research that started in 2020, and the study built on the qualitative study that concerned the healthcare workers, which will be presented by my colleague Anna Vasilevska. The survey is regarding the attitudes and behaviors of the citizens in North Macedonia. I would like to thank the World Health Organization and USAID for the possibility to conduct this study. In this study and in the development of the instrument, we engaged as both local experts and international experts. And as I mentioned, the study is quite voluminous, and I will try to present the most important findings. In this study, we covered several topics as health knowledge about COVID-19, the perception of risks, preventative behavior, emotional factors, trust in information, trust in institutions, perceptions about the policies, and the vaccination topic. Several words about the methodology. We had a qualitative telephone survey, and the data collection was from the 24th until the 28th of February, and it covered 1,022 respondents nationally. So it's built on the study from 2020, and it was approved by the committees from the university clinic and from the World Health Organization. On the following slide, you can see part of the demographic structure of our respondents that were included in this study. The first topic, health literacy or knowledge connected to COVID-19, was examined on several levels: availability of information about COVID-19, information about the vaccines, understanding of the recommendations, monitoring the application of the recommendations. And in March 2022, the citizens assess the healthcare information as less available and less understandable than 1 year ago. 1/3 of citizens believe that the information are easy to understand, and they know what to do if they believe they have COVID-19, and they follow the recommendations for vaccination against COVID-19. 6 out of 10 citizens can easily find the necessary information, both about the virus and about the vaccination, and less than half of the citizens can easily assess whether the information is reliable or not. The next topic is perception of infection risk. Around 1/3 of the population believe that it is probable or likely to be infected with COVID-19. Some less than half of the population believe that the severity of the infection would be severe, and up to 40% believe that the infection would not be serious. We can see that 14% more of the citizens believe that the infection will not be so severe compared to the previous survey. After 2 years tackling the pandemic, we can see a drastic decrease in the implementation of the preventative measures by citizens. The citizens that citizens still follow the recommendations for washing their hands and wearing face masks. And the easiest for them is to use disinfectants and to keep a physical distance of 2 meters. But less citizens report that they go to social events that they want to attend. About the emotions, this was explored in several levels. Do they believe that the virus spreads quickly or not? Is this something that of which they think of always or not? Does it make them feel helpless? Do they think that the media cover the COVID-19 virus topic too much? 6 out of 10 citizens think that this topic is too often covered by the media. But the results from the survey in March 2022 show that there is a significant decrease in the number of citizens that report that the virus causes fear and stress to them. Half of the citizens do not think about the virus, and the same percentage do not feel helpless. Trust in the sources of information. The number of citizens that do not seek information about COVID-19 or do that rarely is significantly higher. Additionally, the results from the survey show that there is a significant decrease in the trust level about all information sources, but the results show that the most reliable sources of information are the healthcare workers, Ministry of Health, and the Public Health Institute. The citizens, as source of information with the lowest level, emphasize the social networks and the traditional media. Concerning the trust in institutions to tackle the challenges brought about by the pandemic, the general physicians still have the highest trust by the citizens, but generally the citizens believe that all health institutions can deal with the pandemic. Concerning the fairness of the decisions, the results of the survey show that the perceptions are much lower. Less citizens believe that the decisions about the spread of the COVID-19 virus are fair, and less citizens are prepared to convince the others that these decisions are fair and right. Concerning the approval of the adopted decisions, the results from the survey in March show greater support for revoking the restrictions and the restrictive measures. More citizens support a reopening of schools and kindergartens and the allowance of the bars and the taverns to function. And less citizens support the restrictive measures such as wearing a face mask and demanding vaccination certificates in bars and restaurants. The topic about the pandemic worries our citizens concerning the economic consequences. 6 out of 10 citizens are very worried that the pandemic will bring about economic consequences, and 4 out of 10 citizens report that their private financial situation has worsened. Compared to the previous studies, there is a decrease in the worries in citizens about the economic ramifications compared to the previous studies. We move on to the topic about vaccination and perception of vaccination.
2/3 of citizens at the age above 18 have reported that they have been vaccinated, and this is a percentage higher than the official statistics of the Institute of Public Health. But 3 out of 5 citizens say that they are not vaccinated. We have observed a low interest for vaccination against COVID-19 among the unvaccinated citizens. 8 out of 10 citizens would not vaccinate themselves if this was there was an opportunity within 1 week. 6% are still not clear about this, and 1.2% of the population are interested in vaccination. The lowered interest in vaccination is due to the fact that the citizens who were highly motivated have already received their vaccine. We have examined some segments related to the COVID-19 vaccinations, such as the safety of the vaccine. Citizens which have a low intention for vaccine are concerned that the vaccine can cause severe adverse reactions. In generally speaking, whether to vaccinate or not, the most important factor when deciding is whether these vaccines can have a negative effect, and also the producer of the vaccine. And this also 49% of those who have low probability of vaccination share this opinion. The risk of infection highly influences 2/3 of those who have high probability of getting vaccinated. 3/4 of the unvaccinated citizens with low probability do not believe that the vaccine will stop the spreading of the virus. 6 out of 10 citizens who are not vaccinated with low probability do not believe that the vaccine against COVID-19 is good for their health. In terms of the social processes, the recommendations from the Ministry of Health about social activities, the recommendation of the GPs are not important for 6 out of 10 citizens with low probability of getting vaccinated. But for the citizens who have a high probability of vaccination, for them it is really important whether the vaccination will allow them to go to concerts and to travel and to have social interaction. 3/4 of the citizens with low probability for vaccination do not agree that most of their families and friends would like to receive the vaccine, or other people that whose opinion they appreciate would receive the vaccine. We had some questions that refer to the national schedule for vaccination. Less than half of the citizens do not believe that they should be vaccinated according to the national schedule for vaccination. We now move to the part for segmentation. If we divide the population in these 5 clusters, we have cluster 1, refusers. I'm talking about population above the age of 18. Then we have cluster 2, who would accept this under stress. Then we will have cluster 3, skeptical acceptors. Then we have cluster 4, who are relaxed acceptors, and then we have cluster 5, who are acceptors who have trust in the vaccine. All these clusters have their specifics, motivations, and social processes. In the cluster of refusers, they are led by the motto that COVID does not exist. This is too emphasized by the media, and they do not trust the institutions and do not want to hear anything about the COVID-19 or the vaccination. These are people with a lower education and probably live outside of cities. They have lower trust in healthcare workers and less interested in the recommendations and show less trust in government sources. Then we have people who accept under stress. They support the routine vaccination. They are largely vaccinated. They have the highest perception of contagion, and very often they think of COVID. They believe that the virus spreads easily and do not think that the media are over-exaggerating. Then we have skeptical population who accept COVID-19. They have higher trust in healthcare workers and in the healthcare system, high trust in government sources. These are middle-aged persons with higher education and living in cities. Then we have the next cluster. These are the relaxed acceptors. They are led by the motto, I'm not 100% sure what is this all about, but I will get vaccinated. These are usually men with average education, and they usually live alone. And then we have the acceptors who have trust. Let's get vaccinated and move on with our lives. We have a high coverage rate and intention for vaccination. They are strong supporters of the routine vaccination, and they are very interested in the recommendation of the healthcare workers and show high level of trust in healthcare workers and in the healthcare system and in the government sources of information. From all the clusters, we can conclude that the refusers, maybe they would never agree to get vaccinated, and we should focus on the other groups. In the end, I will show the key findings and potential interventions. In terms of the information related to COVID-19, I would just like to remind you that the citizens have assessed information as less accessible and less understandable than 1 year ago. We have a significant decrease in trust in all sources of information. As a potential interventions, we can innovate in the access to citizens. We can enable easier access to continue working with professional associations, or to organize trainings with journalists, and so on. The trust in the stakeholders and preventive measures, as you were able to see, the trust of citizens is decreasing, as well as the support for the restrictive measures. We have observed that more citizens support the discontinuation of these measures. As a potential interventions, we should increase the level of trust, to learn from the lessons of other countries, to be consistent in the messages, and to avoid conflicting measures and avoiding mixed messages from experts and spokespersons. Concerning the vaccination, the perception of risk, and the relation to COVID-19, from the result we see that we have a decreased number of citizens who see the virus as something that causes fear and stress, despite the high number of people who believe that the virus spreads quickly. There is more people believe that it has been exaggerated by the media. We should identify the leaders on local level. We should use understandable infographics in order to share the information more easily. And we should also share TV and radio programs with interviews with citizens who have suffered the disease. Regarding the perception on the COVID-19 vaccination, the results show a low interest for vaccination among unvaccinated citizens. The majority thinks that the vaccines are not safe and that they will not reduce the spread of the virus. Concerning the potential interventions, we should assign ambassadors for support and mobile teams, maybe financial impetus or vaccination on other locations, as well as to increase and restore the trust and increase the communication. Thank you for your attention. I apologize for presenting the results quite quickly, but we had a lot of information and I wanted to share all of them with you. We would like to thank Master Ognenovska for her results, and now we will have time for your comments and questions. We expect 2 or 3 questions, and we would like to emphasize that there will also be an opportunity to discuss and raise questions at the end of today's event. The floor is yours. If there are no questions or no discussion, I would suggest that we continue with the event and we will leave this discussion for later. In continuation, we will see the presentation from the findings from the qualitative study among healthcare workers and the COVID-19 vaccination. I would like to invite Ms. Anna Vasilevska, co-founder and head of the Department for Qualitative Studies at the Team Institute, to present the findings. Thank you. First of all, I would like to thank all healthcare workers who participated in this qualitative study and who made a really important contribution to the quality of the study. This is a very rich study. It contains a lot of information, but due to time limits, I will make an effort to present only the most important findings, and all the detailed information will be available to you in the final report that forms part of this qualitative study. The research team has involved domestic as well as international experts and consultants, and I would like to thank all of them for their selfless support during the entire process. This is a second wave of the research. It was conducted in February, March, and the analysis was conducted in April, when, according to the official data, 46.5% of the population were vaccinated with 2 doses, and the booster doses was received by 8.4% of the population, and 70% of the healthcare workers were vaccinated with 2 doses. We can observe that there is a difference between the national target, this is 70% of vaccinated population, and 95% of vaccinated healthcare workers by mid-2022. Bearing in mind that in the process of vaccination, an important role is played by different healthcare workers, in this second wave of the qualitative study, apart from doctors and nurses, we have also involved dentists and pharmacists. The qualitative study gives a comprehensive insight in the barriers and drivers of the process of vaccination. I must emphasize that when we speak about a qualitative study, the findings are not representative of all the healthcare workers in our country, as they are in the quantitative research, but these findings anyway are an important indicator which can help in the development of future interventions. In this qualitative study, we have focused on identifying the barriers and the drivers concerning the following 3 study questions: the personal decision of the healthcare workers to receive the COVID-19 vaccine, then their readiness to recommend the vaccine to their patients, and the third question, the barriers and drivers in the process of vaccination. The data were analyzed by using the Combi model. This is an interesting model which shows how 3 important factors in the end determine the readiness of the person to receive the vaccine or not. First of all, these are the skills, knowledge, and level of awareness of the healthcare worker about the vaccine. Then we have the motivation, the risk assessment, and the trust in the vaccine, and the support from the social environment and the accessibility of the vaccine and the vaccination points. And all of these, in the end, lead to positive attitudes towards the vaccination. This, as we said, this is a second wave of the qualitative study. In this wave, we had 51 health workers who participated. We have organized 6 focus groups, and these involved vaccinated health workers, and we had 3 in-depth interviews with non-vaccinated, 2 doctors and 1 dentist. This is an overview of the demographic parameters, meaning the occupation, the place of living, the mother tongue, and so on. Now we'll move to the main findings. First of all, We'll start the presentation with the findings about the level of awareness of health workers about vaccines. GPs and nurses said that they received official training about the vaccines against COVID-19 organized by the World Health Organization, by the Center for Family Medicine, and by the Association of Nurses. The doctors who work in hospitals and COVID centers said that they did not attend official trainings, but they have received a lot of information from official portals, such as the portal of the World Health Organization, the Ministry of Health, and CBC, and they were in constant consultation with their colleagues. So among this group of healthcare workers, there is no perception of a lack of information about the COVID-19 vaccine. On the other hand, pharmacists and dentists said that they did not receive official training about COVID-19 vaccines, and they were really disappointed and outraged because they felt that they really need such information because they are in constant contact with patients during the entire pandemic, but they did not receive scientific information. So they received information from the internet and from the media, and they lacked total trust in the media, so they required trainings in this regard. That's why there is an evident lack of information among them and confusion in terms of the safety and efficiency of vaccines. For example, dentists have said that in communication with their patients, when they ask questions, instead of responding with scientific information, they share their experiences from their personal experience when they got vaccinated. However, this did not prevent them from receiving two vaccines. Non-vaccinated doctors have not attended any trainings, and they have performed research on their own on social media and on other media. Which information healthcare workers need? Dentists and pharmacists require consistent and apolitical information about the efficiency and safety of vaccines from various manufacturers, and they were very interested in how the booster doses functions in interaction with the vaccines available from other manufacturers, because we know that in our country only the Pfizer vaccine is available as a booster vaccine, so that they can be more confident when recommending the booster dose. The doctors from the COVID centers said that they have sufficient information, but laggers from hospitals, pharmacists, dentists and nurses considered that they need additional workshops where they could discuss the latest findings about the vaccines, and also manuals that would provide a response to frequently asked questions would be of a lot of benefit to them, and they expect that these could be developed by the Ministry of Health. The non-vaccinated healthcare workers do not require any additional training.
When we ask healthcare workers what is the reason why you chose to get vaccinated, we receive the following information. First, to protect themselves, their family, and patients in transmitting the virus, to be a role model both for their colleagues and patients, and to be able to continue to work. All vaccinated healthcare workers have undoubting trust in science and in the vaccines, and they believe that vaccination, together with the respecting of the measures, is the only way to put an end to this pandemic and to bring life back to normal. Most doctors and medical nurses said that it was irrelevant the brand name of the producer of the vaccine, and they had trust by all their patients. On the other side, dentists and pharmacists were quite angry because they were not placed in the risky categories of healthcare workers as GPs were, and that's why they had less trust in the state authorities, but they still got vaccinated. in this group of healthcare workers, there are greater differences. Some of them have less trust in the new technologies for production of vaccines, so they do not trust this technology very much. A significant portion of dentists and pharmacists prefer the Chinese and Russian vaccines because they're more familiar with their techniques of vaccine production, and some prefer Pfizer because they consider it as more efficient and more transparent in terms of the research and about the side effects that could be caused by the vaccine. As obstacles, so we have the stances or opinions of the GPs here, because some of them believe that the protocols adopted by the Ministry of Health concerning the treatment of COVID patients is not applicable in the primary health care, and they demand to be more engaged and more consulted by the Communicable Disease Committee when adopting such measures and decisions. Concerning the booster dose, 40% of the healthcare workers that were covered by this study have received the third dose. The reason why the remaining portion did not receive the third dose because most of them were already infected. Some of them want to get the third dose after the 3-month period is over from the moment that they contracted the disease. And some of them believe that they do not need protection during the summer period because the pandemic subsides. We've noticed that distrust in the protection that the vaccine provides because many of the vaccinated have contracted the virus, and that is why, even though they were vaccinated with 2 doses, and some had a dilemma whether they should receive a Pfizer because they were previously vaccinated with Sputnik, and that the side effects were not substantially examined, and this was particularly noticeable in healthcare workers who got vaccinated with Sputnik in the first 2 doses and are waiting for Sputnik 5 to receive to get the booster. As I mentioned in the beginning, we interviewed 3 unvaccinated healthcare workers. The reason why they refuse to get vaccinated is different. Some of them have autoimmune diseases and thus fear that they will have severe side effects or even death, or because some of them had very severe reactions to previous vaccines, but all of them had extremely high distrust in the vaccines against COVID-19. In their opinion, these vaccines are too recent, that not sufficient time has passed to research the vaccine properly, and they think that the entire action happens too fast. These are people who tend to focus more on the negative consequences from the vaccines that they've encountered in their patients or that they've heard of in discussions with their colleagues. And also, one of their arguments was that many vaccinated individuals were infected and had severe clinical pictures and even died, compared to many citizens who were not vaccinated and had only mild symptoms. Unfortunately, there is nothing that could convince these healthcare workers to receive the vaccine because they have a very low trust in the World Health Organization and in the Ministry of Health, and they require long-term evidence about the safety of vaccines, particularly about patients who have severe reactions to other vaccines. Concerning whether the vaccination of healthcare workers against COVID-19 should be mandatory, most of the doctors and medical nurses say that they support the mandatory vaccination against COVID-19 for healthcare workers, particularly for those that are in direct contact with patients, such as those that work in hospitals, and also those that support the mandatory vaccination support the measure that they should go to work by showing a medical certificate that they've been vaccinated or that they have a negative COVID-19 test. Another serious problem in our health system is that the unvaccinated healthcare workers have to go in isolation more frequently and thereby worsen the situation for vaccinated healthcare workers. So the vaccinated healthcare workers were a bit angry to their unvaccinated colleagues because they had more work to do, and that's why they think that the vaccination has to be mandatory. And then we have a group of healthcare workers that do not support mandatory vaccination at all because they think that it will generate stronger resistance and that the only way forward is to provide continuous education and awareness raising. Regarding the recommendations for vaccination, the vaccinated doctors, pharmacists, and medical nurses, in principle, all vaccinated doctors recommend the vaccination to their patients. The booster is recommended to those that are in the risky groups with chronic diseases, that have received the second dose a long time ago, or that have received the weaker Chinese vaccine. But all healthcare workers lately notice that their patients pose less and less questions about COVID-19 and that the interest about vaccination has decreased largely. The fear is that those patients, the opinion is that those patients who are willing to get vaccinated have already done that, and those who are unwilling to do it will not do it. Those who have received 2 doses and after the 2 doses have gotten infected with the virus will most likely not receive the booster, and lately their perception is that only the elderly get vaccinated or those that want to leave the country for traveling purposes and so on. Obstacles in the recommendation process is that some doctors do not recommend the vaccination to their patients and not rarely suggest to patients to not get vaccinated. Healthcare workers believe that citizens still have many doubts and dilemmas about the vaccination because they have dilemmas which vaccine they should pick. They're worried about the side effects. They're worried and doubt that it will protect them against the new mutations of the virus. They cannot understand why the vaccinated people get infected still because they believe that 2 doses should be enough to be protected from the virus completely, and there is reduced trust about the vaccines, the deadline of the shelf life of which has expired. All healthcare workers have their own method of approaching their patients in the process of motivation and recommendation and providing of the recommendations. The GPs, the pharmacists have an individual approach, and if they have some doubts, if this is a patient with a certain autoimmune disease or some other chronic disease, then they are ready to send them to consult a specialist. The obstacles is that the unvaccinated healthcare workers, the vaccinated healthcare workers believe that there is absolutely no point to discuss about vaccines with patients who are not willing to receive the vaccine, because these are patients who have very low trust in the entire health system and tend to believe in conspiracy theories and to follow this information on the social networks and so on. The GPs believe that the stimulus of 30 dinars per vaccinated patient created more problems and believe that this measure is completely unnecessary. The doctors who work in hospitals and COVID centers have a very do not have enough time to speak with the patients. In what do they have greater trust? Healthcare workers believe that the patients believe them, particularly GPs believe that the elderly over 60 believe the GPs believe that they have trust in them. But they notice that patients in their 30s believe social networks more, and that's why they are the most difficult group to convince. So, and all healthcare workers believe that their unvaccinated colleagues are hardcore anti-vaxxers and that they negatively affect their patients because it's not fair that they have to also fight the pandemic, but at the same time to fight the disinformation and influence spread by the anti-vaxxers. Regarding the mandatory vaccination for citizens, almost all healthcare workers do not support mandatory vaccination for citizens, except for the elderly, the people with chronic diseases, or those working in the education and in nursing homes. And they believe that the mandatory vaccination against COVID-19 should become seasonal. All vaccinated healthcare workers believe that the vaccination process in our country is well done, except for the information about the vaccines whose shelf life has expired and about the booster dose. They think that there is no need to expand the number of vaccination spots against COVID-19, and that there is no need to expand the number of healthcare workers who would apply the vaccine. And so that was all briefly. I would not repeat the findings. I can only briefly mention the two main recommendations that will be discussed during the panel discussion, I believe. So we need current education about all groups of healthcare workers that should be carried out by the health associations. We need to find methods to motivate doctors and healthcare workers to recommend the vaccines and to organize strong media campaign because it was emphasized by all healthcare workers that this was lacking in the previous period. It has to be stronger and louder than the disinformation spread on social networks. Regarding the vaccination process, the COVID centers should continue to exist, and also the vaccination spots and the caravans for certain groups. That would be all in a nutshell. Thank you for your attention.
I благодарим на госпожа Василевска.
We thank Ms. Anna Vasilevska for the presented results. Dear attendees, now we have allocated time for your questions or a discussion if there is a need. And if not, we will continue with the program and we will have time for questions and discussion at the end of today's event. Thank you. In continuation, we have an expert panel discussion about the next essential steps and potential strategies of action concerning the results from the presented studies. We are delighted to invite, first of all, the moderator of the discussion, Mr. Goga Tanas, Technical Officer for Risk Communication and Community Engagements from WH Regional Hub in Belgrade. The floor is yours. As well as the participants in this panel discussion, Professor Alexandra Grozdanova, President of the Immunization Committee from the Ministry of Health, Professor Alexander Petlichkovsky, President of the Commission for Communicable Diseases of the Ministry of Health, Professor Żaneta Trajkowska, Director of the Institute for Communication Studies, and Professor Elena Kiosewska from the Institute of Public Health, WHO national counterpart for behavioral insights. The floor is yours.
And thank you so much for the invitation. I'm really happy to be here today. It's really important that we all participate in the presentation of the findings of such an important block for the whole exercise for supporting vaccination, but not only the vaccination, also supporting the whole effort in tackling the COVID-19 ongoing pandemic. So what we have here, this next wave of BI studies and the qualitative studies presented in thorough by the Team Institute are really important in terms of understanding the needs and the motivations, what are the barriers, and how better we can craft the messages for better communication efforts and other actionable insights that we need to inform our efforts for tackling the COVID-19 pandemic. I'm really happy to present my panel members today, the distinguished guest, Professor Dr. Alexandra Grozdanova, the President of the Ministry of Health Natural Immunization Committee. I also have the pleasure to introduce Mr. Alexander Petlichkovsky, the President of the Ministry of Health's National Committee for Communicable Diseases. Also Professor Dr. Żaneta Trajkowska, Director of Institute of Communicable Studies, and of course Professor Dr. Elena Kiosewska, which is our focal point at the Institute of Public Health, the Ministry of Health, for conducting these behavioral insight studies. So we are going to conduct this panel discussion session on what are the next essential steps on transforming the results from the behavioral insight studies into action. And I would actually like to start with Professor Dr. Grozdanova. What do you think is the significance of the findings and the results of these behavioral studies in the next steps for implementing the national COVID-19 immunization strategy? Do you think that these findings are valuable for your committee for immunizations, and what would be the next steps in your considerations? The floor is yours. Thank you.
Thank you for the questions. Добър ден. Благодаря.
Good afternoon. Thanks for the question. I would like also to thank the stakeholders for organizing this meeting. It is a real pleasure and honor to hear the presentations and the findings from these studies. It would have been very good, when we prepared the national COVID-19 vaccination plan, to have at least some of the insights into these attitudes, just to provide an explanation to the general public. The national COVID-19 vaccination plan in our country was adopted in December 2020. This was the first version. And in spring 2021, we had the second version, and in December 2021, we had the third version. This plan is a dynamic document, a live document. We worked on this together, and I would like to thank the World Health Organization for their findings and for their recommendations at that period. We must bear in mind that the period when the plan was drafted for the first time was a period when we faced a very different situation than the one we have at the moment from the epidemiological point of view, as well as lack of vaccines. Also, there was lack of knowledge about how the pandemic will evolve, and I believe that if the studies that were presented today were produced back then, we would have had much different conclusions. These studies were conducted after 2 years of living in a pandemic, and many of the things, although we say that some things are still not clear, but the situation is much clearer than before. As an information, I have looked at the figures today. We have 64.5, almost 65% of the world population that have received at least one dose of COVID-19 vaccine. 11.39 billion doses were administered. These are 30 million doses of COVID-19 vaccine per day worldwide. So 13 million doses per day, doses that have been administered for the past 2 years. I mean, we are already 1.5 years in this process, and this gives a response to the safety and efficiency of vaccines. The questions and answers that we did not have when we designed the national plan. From the findings of the studies, I could see that we should design a more focused education efforts in order to ensure health literacy. As I previously said, the process of vaccination is determined by two factors. One is the health education of the population in general. It is reflected in the attitude towards vaccination, but also the functioning of the healthcare system. I was really glad that I saw in the studies that the availability of vaccines, the logistics, the possibility for vaccination was welcomed by the population. This was a huge challenge. We must be aware that this challenge, I mean, it was not us, the only ones who faced this challenge. The whole world faced this challenge in the beginning of the process of vaccination. I agree that the campaign was lacking at that period, but unfortunately, when the biggest media campaign was necessary, we had a limited amounts of vaccines. They were predetermined for the healthcare workers. Concerning the next steps on how to make this entire process more clear, I believe that transparency is something we should work on. Many doubts and questions arise from the lack of trustworthy sources. I must point out that 5 or 6 months into the pandemic and towards the end of 2020, we designed the COVID vaccination website where we have recommendations and all the information about the vaccines. But I will say once again, unfortunately, the source of information that were looked for by our citizens and that were more present showed us these professional websites do not reach the people that they should reach. From what we saw, different population structures require different targeting of the campaign. This is in terms of the age and the social aspects. We must continue cooperating with our colleagues. For me, it was interesting to see. I mean, I don't know how many workshops and trainings we have organized, but yes, pharmacists and dentists were not explicitly targeted, and they are also important health workers, and we must share with them information that could respond to these questions or dilemmas. So in the next steps, these studies will be very important for us in terms of designing targeted ways of communication, ensuring better availability of much clearer information about the safety and efficiency of vaccines. Many questions that were raised in terms of whether we should receive a booster dose after recovering from the disease and why people who have been vaccinated are contracting the virus. I mean, all these questions require professional knowledge in order to provide a good explanation. So we should improve the communication of the ministry and of the relevant institutions by providing updated information and providing them at appropriate intervals. And also when it comes, and I think that personal opinions that were aired in the media caused confusion among the general population. So I hope that in the next version of the COVID-19 immunization plan, we will be able to implement some of the findings from these studies in order to have at least a much clearer way of sharing information about COVID-19 vaccination. Thank you.
Professor Grozdanova, really excellent and valid points, and it's really important that you refer to the efficacy of vaccines for just showing on the number of the vaccines administered globally, and it's really very important, and an important and valid point on the health literacy and a bigger transparency for the next steps. And I fully agree with you that we need the findings from this study to help us in building more targeted communication. Thank you so much, really appreciate it. I would like to move next to Professor Dr. Alexander Petriskovsky, and I would kindly like to ask you on the important role that the health workers play on the whole exercise of the COVID-19 pandemic management, and especially vaccination. How could we better motivate and engage the healthcare workers, especially those that, as we saw, have barriers towards COVID-19 vaccination, and to make sure that we use them to help ensure further uptake of COVID-19 vaccination, and what do you think on how can we better strengthen their role in educating the people of North Macedonia? Thank you.
Благодарам за прашањето.
Thank you for your question, dear attendees. First of all, I would like to greet this entire initiative and the presentation of the study. 2 years into the pandemic, the level of information and timely information are key in order to understand how to move forward and to have a successful implementation. Information as well as misinformation are very important, and there is no quantity of information that could be repeated enough. I mean, this is a process without end, because we have voices that share disinformation, and we must be 10 times louder than them. We have seen this ocean of information that should be analyzed in more detail. We have seen recommendations that were given in these studies in order to have most of the benefits. Healthcare workers were key in the response to the pandemic, and we should have been a better example. I mean, we have seen a nice group, around 70% of health workers who very logically and rationally and sided with science and supported the vaccines as the most efficient way of minimizing the consequences. But we have also seen a solid number of 30% of healthcare workers who probably will never accept vaccines. And I believe that this group is the key focus, and that we should target our activities in future on them. I speak as a president of the Commission for Communicable Diseases, and on every meeting I can say that we discuss the strategies, the plans on how to improve the situation, and we raise a lot of discussions. We also opened a discussion about introducing COVID-19 vaccine as mandatory. I would agree with the opinion of the employees in the COVID centers who assume that introducing the vaccine as mandatory would not be positively accepted and would not make a huge difference. I'm more an advocate of the approach that through discussion and information sharing, we can attract at least part of this 30% of refusers. And that's why we plan in the coming period to organize this type of discussions one-on-one. These were planned for the wider public, but bear in mind the information from today. It would be good, firstly, to target health workers. These could be both those who are vaccinated, but more those who are not vaccinated still, in order to discuss and to hear the elements, the reasons why they are reluctant to accept the vaccine. I'm really interested about the 3 healthcare workers who were interviewed in this study who refused the vaccines. I believe that the interview was a longer interview, so I wanted to know whether their narrative changed during the interview or they are hardcore anti-vaxxers. Because I believe that if we start to think rationally and if we re-examine our attitudes, we will come to more logical conclusions. I mean, we have a consensus that although we are in a good situation at the moment, the pandemic is still not over. So the following peaceful month should be used to organize a campaign that will be delivered through the associations. I think this is an excellent approach and an excellent idea. So the associations that are less active to be engaged to reach out to their members. We also had the GPs as a good example. They are well informed and they are confident when they address their patients. The healthcare workers should be a role model for patients, so we cannot allow ourselves. So a patient who is reluctant cannot go into the office of the doctor and get out of the office convinced that he should not be vaccinated. Maybe there is a room to be more harsh with these, how to call them, who deter the patients. I mean, health care workers who are in charge of delivering scientific data, they are deterring patients from vaccination. In the past period, we have also seen that there were health workers who provided opinions that were based exclusively on non-scientifically upheld data. On one hand, we had information, a lot of information provided by the scientific community, but on the other hand, we had a group of healthcare workers who were very loud in sending messages that were not scientifically based. I mean, we have set an objective of 75% of the general population to be vaccinated and 95% of the healthcare workers to be vaccinated. And I think that the actions of some of these health workers were really to the detriment of this objective. We should organize a campaign that will target the general population, but also through the associations and also through a personal, an individual approach. I believe that although some of the people will remain deaf to this information, but I believe that some of them could change their mind. Thank you.
That the pandemic is not over, and definitely the role of the healthcare workers is crucial. It's of crucial importance, and I can't stress it further for how much we need to work with them and strengthen their efforts, both in terms of training them that, as we said, it's strange that you have healthcare workers that still don't believe in vaccination. So their role is also crucial in trying to convey our messages for supporting vaccination for the patients. So really thank you for your contribution. I would like now to give the floor to Dr. Żaneta Trajkowska, the Director of Institute of Communication Studies. And I would like to ask her on what does she think is the importance of tracking and understanding misinformation, as rightly Dr. Petrichkovsky talked about misinformation and disinformation, in terms of helping us to inform the risk communication strategies, and what do you think also is the role of media literacy that also Dr. Petrichkovsky tried to touch on? Thank you so much. The floor is yours.
Thank you.
I would remove the mask among so many healthcare workers. I feel really safe. and it's easier to speak. First of all, I would like to thank you for inviting me. I believe that the data from these studies have shown that communication and information sharing with target groups as well as with healthcare workers is really important, maybe most important, especially in the 21st century, when we say that information is the most valuable thing in the world. But if it's a misinformation, it can be a really expensive thing and even detrimental. These data are really precious, and they should be a basis for the development of further strategies. It was interesting for me to see that in the qualitative study, most of the participants involved were women. This probably means that medicine, just like journalism, is a female profession. I hope that this will be reflected also in the managerial positions. And they were also in the middle age, which is slightly depressing for me. When we learn about crisis communication, we say that crisis communication happens before the emergence of the crisis. This means that the strategists should predict and should assume what could happen in order to reduce the consequences of the crisis. The whole world was surprised by the crisis, but if we have a good crisis communication, we can reduce the consequences. And from now on, we should think about the next potential crisis and how to reduce the damages from the sharing of disinformation and misinformation. Unfortunately, we do not have an appropriate translation for mistranslation. There is a slight difference between disinformation and misinformation, but when we have sharing of misinformation, this is done without awareness, without a bad intention. But when it comes to disinformation, this is with a malicious intent. When it comes to COVID-19 and in Macedonia, as well as in the region, we have faced a lot of misinformation because people did not have sufficient information from official sources, and all of us lived in our information bubbles that are appropriate to our values, and we just see the opinions of people that we agree with, and we share this. And we are not aware that this information might be a misinformation or that it might lead to wrong conclusions. We cannot prevent this. Data shows that even people with higher education, like doctors, do not trust the vaccines. So we must depart from this point. What can we do? First of all, you as health workers and as organizations and state institutions who are in charge of this, one thing is most important. This is open and transparent communication and permanent communication. Once you close the source of information, you have a lot of disinformation and semi-truths. We as a general public want to know what happens, but if we do not have continuous information sharing, I mean, we risk being boring to people. But if we are not consistent, we leave more room for misinformation and disinformation. Unfortunately, this was not present in the past 2 years. We had periods where the official sources of information were totally closed, so the media was trying to find any information that is available out there. The general I can share with you the first moment. I mean, I have publicly shown my respect for the previous minister in the initial months when we had a good and consistent communication. The situation was very serious, but the public was assured by the institutions. We had daily reports, daily press conferences, and so on. We were all aware of the seriousness of the situation, but we were also aware that everything was done within our possibilities. So the general public can recognize when fake news are shared and when the information is not shared in totality. And with this, it can lead to loss of trust. So where is media literacy here? Media literacy is very important, but this does not provide a quick solution to the problems. In order to establish a long-term media literacy, we need years, 5 or 10 years, so that the new generations that now are in school education could know how to recognize, to know how news are produced, who can have an impact of the news, how to have a critical approach towards the news that you see, to create your own news and to activate yourself. This requires time. So if we are talking about a society where we'll have an educated citizens, we must work on all fronts. On one hand, regardless if we work in healthcare, education, or any other segment, we must push for establishing media literacy through the formal and informal education process. On the other hand, we must be honest to ourselves and say that if we have engaged with this, we must be open and transparent in our work. This is the only way how to reduce the harm from disinformation and misinformation. This study has shown that we know the situation very well. The messages do not work for everybody. We must create the messages and the approach tailored to the targeted group. We can see that they are divided by gender, but also by their perception to COVID-19. And in this way, we should design the mechanism and the message that we send. This is a long-term process, and studies have shown that those who are refusers in the cluster of refusers maybe will never be vaccinated, but if we achieve all the rest who still have doubts to accept the vaccine, will reach a high vaccine coverage rate, and we will have a much lively society that is well educated and knows how to adopt a well-informed decision. Critical opinion is very important, and it means that all questions will be raised by the public, those that you want to answer and those that you do not want to answer, and we should strive for such a society.
Thank you very much, Dr. Trajkowska. It was really cool, and we all know that the whole issue with echo chambers and the filter bubbles and the whole fake news history, they are eroding trust, and how important transparency and the ongoing communication is, and especially as we all seem to make the same point, the targeted communication is really valuable for informing our next actions. Thank you so much. I would actually like now to go to Professor Elena Kiosewska, our focal point for the behavioral study at the Institute of Public Health and the Ministry of Health. And I would like you to ask, like, how creative, given the findings of this study, that informing our actions, can we be as public health workers in this situation that we are currently, like, for example, with only 46.5% of the population is vaccinated with 2 doses, and only 8.5% of the population with a 3rd dose, which makes them, like, we're facing this huge resistance from the remaining population to accept COVID-19 vaccine. So how can the Institute of Public Health further support the preventive health interventions and education of the population, taking into account all the lessons that we've learned so far, given also the findings of the study? The floor is yours, Dr. Kiosewska.
Thank you. First, I would like to express my gratitude to the Ministry of Health and to the World Health Organization, who allowed us and enabled us to carry out these very important behavioral studies in our country, which provide us with guidance on where should we focus our public health policies. Public health is a very broad term. it doesn't cover only healthcare, but also all other sectors in one society. Public health is an area in which every individual should be included in the implementation of the main goals. In this sense, in the fight against the COVID-19 pandemic, but also the fight to enlarge the vaccination coverage, we have to work together. The Public Health Institute and the 10 healthcare centers represent the public health network in the country, which primarily ensures the protection of health, but also that works on prevention and elimination of diseases, regardless if they are communicable or not. In this sense, the Public Health Institute from the very beginning of the pandemic was included in all activities aimed at providing better information to citizens, increasing the vaccination coverage, and so on. All departments within the Public Health Institute, each in its relevant area, were engaged and contributed to the results that we've achieved today. But this doesn't mean that our engagement ends here. We continue with our efforts. I will mention what the future measures would be that the Public Health Institute could take in order to help, if not for full, then at least for partial accomplishment of the national goals by the mid of June this year. First and foremost, I think that the most important areas would be 3 areas, starting from the results that we saw in the studies. First, in the training of healthcare workers and in targeted groups such as dentists, pharmacists, and also other healthcare workers that are radiological technologists, the physical therapists, and so on. Through the Macedonian Health Society, Macedonian Dentist Society, but also the associations of healthcare workers that have a secondary and tertiary education. We also have experts that are part of these associations, and thus we can also include them both directly and indirectly in the carrying out of trainings aimed at providing valid, most up-to-date and most accurate information about the disease and about the vaccination. The second area would be the work with population. In this activity, from the public health aspect, we have to activate more all work collectives or schools, all local self-governments that have to work again together with the healthcare workers in raising the awareness, but they would not only receive information about the disease and vaccination, but rather about the communication skills and abilities. I am saying this both as something that needs to be enhanced and intensified as an activity in the future period, not only by the Public Health Institute, but by all associations as well. and together with the Institute for Communication Skills, and to also increase the communication and structural competencies of the healthcare workers, because we are multi-cultural and national society. We have different traditions, habits, and so on, and we need to adjust our trainings and information according to their different needs, to the different needs of the population and of healthcare workers. And thirdly, I believe that we need to provide input to the request made by the healthcare workers, but also by the population, that they need statistical data, information about those questions that cause dilemmas for them. Perhaps we need more in-depth analysis or study to be carried out by the Public Health Institute in this regard. What share of our patients or citizens expressing distrust base that distrust due to lack of knowledge and information, or because lack of will? Because the psychological moment is very important here, and in this approach towards the citizens, we should perhaps apply a multidimensional approach by including colleagues, experts from the psychology field, and the work with young people. We said that the 30 or 40-year-olds and the younger population believe that even if they get sick, that will pass without any severe symptoms. And here we need to apply the multidisciplinary approach, which is a principle in healthcare. So in conclusion, the activities to be carried out in the future need to have or be accompanied with a more serious multidimensional campaign covering all segments of society, which will allow us all together to work on accomplishing the motto of this year's European Immunization Week, which will happen from the 24th until the 30th of April, which says long life for all. Thank you.
Really valid point that you encourage that we need to all work together, because it's not a job being done by only segment or one only part of both the healthcare authorities, but also from the community engagement part of the work. And you clearly outlined the 3 next actions that we should follow on, based also on the findings of the study, which are of crucial importance. We need to continue, you said, with training the healthcare workers, with engaging and updating the information, and addressing the inputs with statistical data, which I think it's of crucial importance. But this whole needs to be in a tailored approach. It's not one single bullet that you can fill in the requests and you can complement for the needs that are required for training the healthcare workers. I think as a wrap-up of the discussion, we all agree that all the participants made a crucial point that we need to be open and we need to be transparent if we are to build more trust in communicating with public opinion and also different segments of the COVID-19 pandemic response, the healthcare workers, the healthcare authorities, also the education sector with using teachers and children and other leverages of the communities and the communities networks that we are surrounded with. We all agree that we need to be open. We need to have a continuous and honest discussion if we are to build more trust with them. Another valid point that I think we all the panelists made in the discussion is that we need this tailored approach or targeted communication. We need to speak to different community groups, to different community structures, to different targets on a different language, and probably using different communication channels that we can reach them and make information accessible to them, and make them talk and engage about supporting the COVID vaccination support. Please go ahead, Dr.
Dodam i da prokomentiram.
Yes, I would also like to add one more thing. I liked Professor Jusaska's advice and approach that we need to direct our attention to the collectives as functional cells of society. Without speaking to the entire public, we should direct our efforts towards associates or experts from the other side that are willing to accept the doctrine in a way. And in this sense, I would like to give you a concrete example. I had a working visit in the factory of Kronberg and Schubert in Bittel, and I was shocked by the manner in which they were organized and dealt with the crisis. The numbers are quite staggering. They've achieved over 85% of vaccination among their employees, and that was done by the encouragement of the management. But they have over 5,000 employees, and I don't think that only the vaccines enabled the good results throughout this 2-year period of the pandemic, but also they included very strong measures, protective measures for taking care of their employees and preventing the disease from spreading among them, as by working in shifts and different measures. So my point is that even though we have many disinformation and negative things happening on the social networks, there is a way to organize yourself properly and to achieve great results. So the final conclusion should be that they had no transmission of this disease during this 2-year period, and their employees worked in a closed area, so in a closed space. So that was quite amazing.
Improve our communication, and we can showcase them in order to improve our communication. It brings me to the other point that we, in a way, all raised about media literacy, how important it is for both us on the health sector, but also the public at large, to learn about the role of media and see what kind of importance different channels, the way they use and the way they frame messages are for our communication strategies. And of course, we all made this point on misinformation and disinformation. I think it's of crucial importance because we've seen over the past 2 years that there's an ongoing discussion on what we call the fake news and not quite so true information about fears and playing with our emotions regarding to COVID-19 vaccination. It also brings me to the other point, because we all agree that it should be open and transparent, but honesty. You made this valid argument that we need to be honest about that. As you rightly said from the beginning, we were not well prepared. Everything was unknown to most of us, and we needed to draft our messages. We needed to inform our communication efforts, and I agree it's not an easy task, but being honest helps. These are the facts, these are what we have now, and being honest with the public opinion on what we need to share with them, it's a very valid argument and helps our communication efforts.
If you allow me, just се слушам комплетно, благодарам за...
Yes, I completely agree about the constructive comment, and I agree about the communication part. The communication in healthcare crisis, not only in Macedonia, but worldwide, is very important, particularly the sources that you rely upon when you give the statements. The information availability is now click-based. Everyone can read the last message of the World Health Organization or CBC's information. So it's up to the choice of the individual which information source they will use and trust for obtaining knowledge. And of course, the media communication. I would like to praise the media because many of them became healthcare experts. But I think that the healthcare is a specific sector, and it's not enough to only read 2 or 3 articles to be fully informed about the vaccines, for example. And that's why I think that we should also have training for the media to clarify matters to them and to make sure that the population receives the information from good channels.
Thank you very much, Dr. Grozdanova. Exactly, that's I fully agree with your point. And the next issue, when we talked about this continuous effort, it's not something that you do at the beginning and it stops. It's a continuous effort, and as rightly Dr. Janeta said, we need to prepare for the next crisis. So this is, with all its unfortunate implications, it's actually really good in terms of taking stock or how to take the best practices and lessons learned for getting prepared for the next crisis. So it's actually the right timing to start preparing and make sure that first we have the know-how, and secondly we have the capacities to get engaged in tackling the next communication crisis for the pandemic. With that in mind, I think this is a wrap-up of the discussion we had with our distinguished panel members. I don't know if there's any questions from the plenary that you would like to... There's 2 of them, sorry.
Thank you for your discussion, and now we will continue with the questions or comments by the auditorium. Please introduce yourself and give us your comment or question. Thank you. My name is Dr. Žarko Karadžovski. I do not intend to pose questions. I only want to give you my comment. I apologize. I don't know how should I position myself. This would be more politely, I think. First, thank you for the invitation to attend this event. I would like to thank the panelists and the presenters of the findings from the studies. I have some comments about the activity. I agree with some things. I disagree with others. And I always mention this loud and clear. The numbers that we saw in the study did not surprise me because I think that they are even worse. As a former president of the Committee for Communicable Diseases that was fighting this pandemic, we were set up 2 months before it was disclosed to our country that there are knowledge that in the Wuhan province, something unusual is underway. So we read materials, we got educated about what the world was presenting. If there was information from China that something was underway, and you already know how the possibilities for obtaining information from China are, because they're usually hiding things or at least delaying them for months, we were obliged to, under quotations, buy knowledge from the globally renowned websites. And to that end, the committee that was set up had meetings twice a day. In those period, in the period before it was disclosed that the virus was spreading globally in our country. So somewhere in December, we started preparing for what was about to happen. And if we understood there that Wuhan is a closed city, if you can remember the images and the videos that we saw, it was a huge town with many millions of citizens and whose streets were empty. It was clear what we could expect. I consider myself as a seasoned practitioner because over 30 years I've been working in this field. There is something that is called past experience and lessons learned. We had the pandemic influenza, the morbilli outbreak, measles outbreak, epidemics that started from SARS some 15 years ago, so we were ready that something will happen in our country. To that end, the Communicable Disease Committee that was set up by renowned professionals in the area and not party loyals, because I read some of the comments of the respondents that this was a committee that was neutral, professional, and competent. So in one word, it was quite professional. It was hard to see that someone discredited us because our country is very politicized, and every scientific finding or any promotion that we publish can be faced with opinions such as we do not trust them and so on. I've been attending government sessions 5 times, once at the President Pendarovsky, and on press conferences with the Ministry of Health over 10 times. And the media agencies and renowned TV stations, apart from posing questions about uncertainties and dilemmas about the pandemic, they were very much part of the disinformation process, and they always started posing politicized questions. For example, do you feel yourself responsible for the infections and the death of this many people? And I can responsibly claim that if we did not take the measures that we took back then, closing the kindergartens, closing the schools back then, if we did not introduce curfew and so on, I can guarantee that we would have 25,000 deaths and even more infected, because we have limited time. Could you please tell us in a nutshell your point? Yes, because after I left my position as a president of the Communicable Disease Committee, nobody asked me about my opinion about what is going on. If the Communicable Disease Committee allow me, I took my mask off, and the government will decide whether I'm allowed to do that today or tomorrow. Professor Dr. Jovanka Karadzinska, I come from the Medical Labor Institute, Occupational Health and Safety Institute. I have to calm down the discussion because I think that we are here for a positive thing. Is there something positive in a pandemic? Well, there is, yes. When we come out of a pandemic as winners, but we do not forget everything that passed. I think that it is a nice thing that this is a communication in life and that we are all gathered together, because it's been long since I've attended such an event. I would like to thank the World Health Organization's office in our country for organizing this type of event, but not only that. and not only their support in these 2 years, but also for providing us with their support from the moment that they set up their regional office here. I would like to thank Professor Tiosevska, who is a supreme professional, and we are lucky to have her as a professional working in the health sector. She's a leader, and she carried out excellent studies. Whether there are some divergences in the numbers or not is irrelevant, because we received valuable results and findings. I would like to thank all professors and doctors for the introduction that you provided us and the excellent panel discussion. And I would now like to go back to the 2 key points which we, as an institute, covered in our health, in providing our health and occupational health and safety for the workers. We've been working over 30 years on ensuring the health and protection of health workers. We've had support by the office in the country and the regional office, and we've been putting a lot of efforts both locally and internationally, because the Institute is also a coordinator of the network of the Southeast Europe, which includes 9 countries, for the occupational health and safety, which is an expert network. I will reach 2 conclusions or emphasize 2 important points. We are working with the support of the office and USAID on the steps that would mean future strategies. One is that we haven't forgotten the occupational health and safety of healthcare workers in the vaccination spots. They should not be forgotten, because they have a lot of work to do yet. And as Professor Trajkovska mentioned, the first key moment would be the lessons learned. What have we learned? Because if you approach people now and tell them you need to be vaccinated and so on, it will not be well understood. We should understand their experience, what they went through. We need to, we say, we go back to normal. I cannot say this as a human being, that we take steps towards a more balanced, more normalized situation. And what is normal now is up to discussion. So that's why what is key for us should be the lessons learned. And that's the basis for communication, so that what will happen or what could happen, that we would be prepared for that. Because we need to understand what the healthcare workers in the region learned and what they went through in this past period. And the second key is the healthcare workers.
During this entire time, years back, we are insisting on the thing that health and safety at work of healthcare workers, who are not only the skeleton, they are the pillar of the healthcare system. So we must ensure healthy and safe work conditions. And at the same time, I mean, this is not something selfish. Let us be healthy. I mean, with this, we will also enable better health and better quality and standard of services to our patients. A healthy and safe health worker will be much more efficient and will provide better quality service. And our healthcare system will be much functional and will more functional and more efficient. But if the healthcare worker is overburdened by the amount of the salary and by diseases, I mean, we had more than 400 requests. We are also an institute for verification of occupational diseases. There was some criteria that were not well established. That's why we reacted through our association for these conditions to be improved. More than 400 healthcare workers applied for verification for COVID-19. So if the healthcare workers are the one we focus on, and I would like to thank Professor Potlichkovsky. I mean, you are much younger than me, but you think about the healthcare workers. So one of the activities that we plan in the coming period is how to influence on the healthcare collective. Preventive health examinations is part of the work of our doctors and the network that we have. And to wrap up, I apologize for taking too much time, but I am really emotional, and I apologize if I look like a music star here with a microphone. I would just like to finish with one call, with one initiative. I mean, the minister was informed about this. We have a preliminary support by the Ministry of Health and by the World Health Organization to develop and prepare a national program for protection of the health of healthcare workers in North Macedonia. I would like to ask for your support to work together. We will include the Doctors Association, the Pharmacists Association, the Association of Nurses and Midwives, and the trade unions, which are really important. We will involve the Health and Safety at Work Services. We will include the Ministry of Health, the Ministry of Labor and Social Policy, and we expect all jointly to push forward this program. So I invite you and I ask for your support for this initiative. Thank you. Thank you for your comments. We can move on with the discussion. The gentleman in the seventh row. Good afternoon. I would just like to add to what Professor Karadzinska has said. I'm Professor Mijakovski, and I work in the Institute of Occupational Medicine. We have used this pandemic in order to conduct several studies that were encouraged by our institute, and we had support by the WHO office in Skopje and from our colleagues from Southeastern Europe. Therefore, in such a way, we conducted a study involving 4,621 respondents. This referred to the stress factors on the workplace, on the job engagement, and on the burnout syndrome. What we received as results? Well, we discovered that nowadays the burnout syndrome dimensions are much higher, meaning emotional stress, both in our country and in other countries in Southeastern Europe. What really raised my interest, despite the high level of burnout syndrome, we had also high levels of energy and devotion by healthcare workers. In this way, and through some regression models, we showed that in the psychological functioning of a healthcare worker, there are two processes taking place. One is the energy process of wasting energy that leads to burnout syndrome, and the other one is the motivation process, which, by using the resources on the workplace, enables the workers to be energetic and devoted to their work. Further on, we plan with our colleagues from Southeastern Europe to conduct a longitudinal study that will show how these processes will further develop. I would like to urge, with maximum use of the resources at the workplace, such as support from colleagues, from superiors, teamwork, stimulus and impetus for the job well done, I believe that we will be able to reduce the levels of burnout syndrome and that we will be able to stimulate healthcare workers to be energetic and devoted in their work. Thank you. Thank you for your comment. And now, dear attendees, we have time for 2 questions or comments at the most, if there are any. Please. I'm Professor Michał Goczulowski from the Institute of Public Health, and I will just briefly say, in the context of today's discussion and topic, we, as an Institute of Public Health, for example, when the pandemic started and when we started with the vaccination process, we, as an Institute of Public Health, wanted to give an example. As stakeholders in the public healthcare sector, so that the people who work at the Institute of Public Health be vaccinated and to reach a coverage rate of 95%. We achieved this. Director is the witness of this, and the other colleagues. This was achieved through personal, by giving positive examples, personal examples, and personal engagement of all the managerial staff. One of our employees also consulted Professor Petlichkovsky in order to consult them about some allergies, if they are a counterindication for the vaccine or not. So this was a really positive example and a good model to be followed by the others. Thank you. We would like to thank all the attendees for their comments. Allow me for a brief summary of today's event. The speakers and the panelists share with us the key results from the undertaken studies. The most important and relevant stakeholders of the healthcare system, with the support of the partners, will explore the opportunities for urgent implementation of the conclusions from today's event in order to increase the COVID-19 coverage rate and the regular immunization coverage rate by continuous upgrade of the capacities of the healthcare workers and by continuing the communication activities by applying new strategies to address the most vulnerable and marginalized categories of the population and every individual in North Macedonia. The sufferings from the COVID-19 pandemic will be ingrained in the memory of the world for a long time, but the pandemic has also allowed the society to see the enormous significance of the healthcare sector and the need for strengthening the mutual relations with the other sectors, especially with the economy and education. Let's not forget, the pandemic forged a link between all the citizens of the world. Solidarity is a key dimension of future societies. Leave no one behind is not a slogan. It's our collective duty. Dear attendees, thank you once again for your attendance and for your attention, and I would invite you to join us on a cocktail lunch in the outbuilding next to the tennis courts. Thank you.